Giovanni to introduce all the speakers and to moderate the table. Thanks, Giovanni and everyone.
Thank you very much. Thank you very much. I'm happy to moderate this very interesting panel. As highlighted by this morning during the session by Holman and by Marco Iacuito in the morning, the role of public procurement for innovation is also from an economic point of view and from a policy point of view crucial. Probably is one of the most powerful policy tools governments have to shape markets and to drive technological progress. This is also what Marianna Mazzucato in her seminal book on entrepreneurial state highlight. So governments have the chance, instead of just feel and address market failure, to shape new markets and to drive breakthrough. And this is what public procurement for innovation is about, because this industrial policy instrument could allow to lower the risk for SMEs, to easily scale up their technological solutions, and to build in this way new markets. So I would like, and I'm happy to moderate this panel, listen from the contractors, their experience and their insights. As you can see, we are going to have several speakers involved. So my role as a moderator will be also the timekeeping, because this is my KPI as a moderator, and I will try to do my best. First of all, I will give the floor to the speakers to allow them to introduce themselves, and in 1 minute, please pitch their solution. Then we can have time for a second quick round of table, speaking about the experience you had in this public procurement process within the RaDAR project. So I will start with Luisa Claraso from Alifax. The floor is yours, Luisa.
Thank you so much, and thank you for the opportunity to participate in this project, in this roundtable. I am the general manager of Alifax. I will try to reduce in 1 minute my speech. I am not sure that I can do. Alifax, we are participating in RaDAR project, focusing in a phenotypic screening multi-drug resistant organism. Antimicrobial resistance is not only microbiological issue, it's something that today we saw every time. It is a system level challenge, and this is something in Alifax we know very well. Approximately 9 to 10% of hospitalized patients may acquire MDRO colonization, which is significantly higher rates in high-risk wards such ICUs. For that, we think that early identification of carriers is therefore essential to prevent the transmission and guide the appropriate management. We know, all of us, that the conventional culture based on screening typically, and we listen during the meeting today, requires 48-72 hours. And during this period, we think that the clinical and infection control decisions are made under uncertainty. Our solution as Alifax is an automatic phenotypic screening system providing results in 7 hours, more or less. But I think it's really important to say that it detects express resistance to carbapenem, CSBL, and C, and others using swab samples. Why I am saying this is a phenotypic method. It shows that the microorganisms actually respond in presence of antibiotics. Identifying the real resistance. Let me to say, how the bacteria actually respond to antibiotics. And I think this is particularly relevant in this dynamic antibiotic-resistant landscape, where the resistance mechanisms are continuously evolving. If we think in screening, and I think it's important here in this meeting, screening programs are applied systematically and scalable. That means that need to be not only speed and rapid, sensitive, need to be also economically sustainable. And this is something that also we listen during the meeting. The key value lies in the same day risk stratification. That means that the clinicians can isolate the patients or desescalate when it's necessary. And that matches very well with the RaDAR project, I think, because RaDAR has highlighted the rapid detection alone is not sufficient. It needs to be integrated in this AMR management. Finalizing is innovating for me in AMR is not only about the speed, it's about the scalable detection integrated in the clinical pathways.
Thank you very much, Luisa. We go back to your experience in a few minutes. Javier, Roncero from Altair Health. Can you switch on your mic, please, and introduce yourself and the solution? Your mic is switched. No, we cannot hear you, Javier.
Javier, you are muted.
You are muted.
No, still, oh no.
So,
should be on the abajo del todo a la... Sí, no, aún estás muteado. I'm
okay, while I suggest, while Javier is trying to solve this technical, small technical issue, I will give the floor to Francesc Güell. Please, Francesc, are you?
Yes, hello. Hi, everyone.
Hello.
Thank you very much for the invitation. Thank you for allowing the industry to partner in improving healthcare policies and also helping the healthcare system and also patients to benefit from the value that in this case, molecular technology can bring. My name is Francesc Güell. I am the Government Affairs and Market Access Lead of Cepheid in Iberia. Cepheid is a molecular diagnostic company. We develop rapid PCR tests for viruses and bacteria identification through what is called our GeneXpert system. GeneXpert platform is very scalable in terms of it can perform a few tests or a big amount of tests with a randomly access, and it's extremely easy to use. It allows to deliver the highest precision PCR while also simplifying the sample processing. For this project, for RaDAR project at the Institut Català d'Oncologia, we provide the rapid PCR solutions to detect 3 bacteria. The carbapenemas-resistant enterobacteria, the methyl-resistant methicillin-resistant Staphylococcus aureus, and the vancomycin-resistant enterococcus. These 3 pathogens are recognized by the WHO as a major AMR threat, and ECDC has included them in their call for action to member states. So we are addressing three of major problems on AMR control. These are primarily transmitted in hospitals and also in other inpatient care environments. Expert rapid PCR technology enables hospitals to screen at admission the asymptomatic patients that are at risk of carrying, of being colonized of this bacteria, and it helps to protect vulnerable patients who could be affected if exposed or could be colonized by others. It is, in simple terms, if we detect carriers among high-risk patients early, we prevent new colonization. Then we prevent asymptomatic patient transmission, and we contribute to prevent the spread of antimicrobial resistance. It's a preventive approach in which we reduce the need to expose patients to last generation antibiotics. This helps protect the effectiveness of the antibiotics and slows down the resistance, and improves also patient safety by reducing these nosocomial infections in the hospitals. The implementation in Spain could work as a bundle with the optimization of the antibiotic programs used, PROA, that are called in Spain, creating a synergy which would improve the results on our patients. This is our value proposition, and this is what we do in the RaDAR project with Institut Català d'Oncologia.
Thank you very much, Francesc. Thank you very much. Gaetano Cafiero from Kelyon.
Good morning.
Good morning.
Good morning, everyone, and thank you for the invitation. It's a pleasure to be here with all of you. I'm Gaetano Cafiero, Chief Executive Officer of Kelyon. Within the RaDAR-PPI project, our role is to provide a practical decision support environment that helps healthcare teams to detect trends early, strengthen antimicrobial stewardship, and respond faster to relevant infectious signals. To address this need, Kelyon is delivering Antimo, our platform for antimicrobial resistance and infection control decision support. Antimo is the result of 4 years of applied R&D developed by Kelyon, together with clinical and academic partners such as Istituto Dermopatico dell'Immacolata di Roma, IDI, and University of Salerno. We built it starting from real frontline workflows with one clear objective: to turn microbiology and infection control information into timely, actionable insights for faster action that teams can use in daily practice. So Antimo doesn't add complexity. It helps clinicians, microbiologists, and infection control teams see what matters sooner, coordinate decisions, and act with more confidence. In RaDAR-PPI, this is exactly that the need that we support, making AMR and infection control data usable for faster, better informed actions. We started from a very concrete frontline needs, sustaining AMR surveillance, improving antibiotic appropriateness, getting faster visibility on infectious events, and enabling smoother collaborations across teams. In RaDAR-PPI, this is the need that we address, turning microbiology and the infection control information into timely, decision-ready insights that teams can act on. Antimo delivers one monitoring and reporting environment, guideline-based decision support with the traceability, and a real-time dashboard with exportable reports, and structured AMR insights that different teams can share and use consistently. So the outcome is less fragmentation, faster understanding, and better coordinated actions around the same signals.
Thank you very much, Gaetano, for your presentation. Let's go back to Javier to check if, yes, it seems that now the mic is working. Please, Javier,
sorry.
Introduce yourself and the solution you introduced.
Yes, thank you so much. I'm sorry. For our perspective, the most challenging and the most valuable aspect has been the opportunity to work on a critical and concrete need, monitoring hospital-acquired nosocomial outbreaks in real time. The RaDAR framework enabled us to deploy an end-to-end solution, mass sequencing of multi-drug resistant microorganisms plus bioinformatic analysis, and above all, to integrate it into the workflow so that the information is actionable. The joint learning process with hospital teams has also been extremely valuable, and as it has helped improve both the system and its adaptation.
Thank you, Javier, for highlighting already some of the experience you had within the RaDAR project. Thank you.
Thank you.
Laurent, Bellavance, could you please introduce your company and the solution, the technological solution?
Yes, absolutely. You can hear me?
Yes.
All right. Very good. Thank you. So, hi, everyone. I'm Laurent Bellavance. So I'm Vice President for Business Development for Nosotech. Nosotech is a software development company. So we've been working on infection control and antimicrobial surveillance for quite a few years. The main solutions that we provide to hospitals are Nosocos and Antibiocos, which are software package suite that is installed within the hospitals, and that makes the best of data connectivity with all the different software and clinical software inside the hospitals that are required for providing a central standardized patient view of all the different elements that are relevant to infection surveillance and antimicrobial use and optimization surveillance. So one of our key, let's say, expertise and strength is definitely on data connectivity, so which is a crucial part of getting these type of tools and software implemented in hospitals to provide the benefits of the tools. That brings me to why we make a difference for hospital clinicians is definitely because we provide in a single software tool the complete view of patient data coming from the patient record AMR system, the EMR, sorry, patient laboratory data view. We can connect to the, of course, we connect to the pharmacy data, we connect to operating room data, patient movement, all of this connected in real time in a central tool that clinician can use and then optimize how they work. Because the challenge for them is that right now to do their job, they have to work with many different software, which have not necessarily a common way of getting the data together. And they also need to align with national surveillance program where they need to collect and provide data for surveillance evolution and the different criteria of the surveillance programs, which is very, very time-consuming, difficult, and needs some really specific resources to do that. Those people won't necessarily be assigned to what they have to do in terms of infection control and surveillance of antimicrobial use. So our system will provide those tools and give like specific features like real-time outbreak surveillance and management, real-time monitoring of antimicrobial use and optimization actions. Of course, patient tracking and contact tracing in the hospital. Those different tools are used on a daily basis by the clinicians to help them take actions quickly. So the real benefits is definitely time and to reduce time to actions and isolate patients and then monitor the whole cycle of the infection evolution within the hospital. So we are experts at data connectivity and of course the clinician tools up to the end-to-end process.
Thank you, Laurent. I would like
Very good.
to ask you then about your experience, but before of that, I would like to have the last contractor present the company and the solution, Qualud, with Eudald Mas and Luis Crespo, who is going to start.
Good morning, everybody. Thank you for the invitation of the meeting and the participation in this roundtable. Well, I'm Luis Crespo. I'm Qualud's project manager, and with me there is Eudald Mas, Qualud's CEO. And well, Qualud is a digital innovation company specialized in the healthcare sector. And our mainly area of expertise is the design and development of software for healthcare institutions, both private and public. Also, we collaborate with research institutions like BioGipuzkoa. And what we specialize is in the design and development of humanized and digital solutions for real problems that generate impact to boost health. And in RaDAR, our participation is the design and development of a digital platform which provides evaluation and an advanced interoperable and secure technological centralized solution aimed at enhancing the capacity of project buyers like LRC, ICO, UNIRA, and RESA to analyze and manage all the data related to the antimicrobial resistance. The solution that we provide through the form of this platform is based on a scalable SaaS architecture with multi-entity and multilingual support, and provides integrated functionalities for data upload, validation in structure and content, visualization, analysis, and reporting, all from a user-centered perspective.
Perfect. Thank you for keeping your presentation short. So we have the time for a quick second round of exchange of ideas. Speaking about your specific experience in this public procurement process, and I would like you to point out a specific challenge you had to face, and on the other hand, the value as a positive aspect you would like to highlight in dealing with the RaDAR public procurement process. Again, please consider that we are running out of time. Luisa.
Okay, thank you. From our perspective, I think that public procurement is something that for us is not the main challenge, because we normally sell to the public healthcare systems. But what was required the most important effort is understand the clinical workflow in this project behind the technology. For example, map how the samples move through the hospital from the collection to the lab for processing the samples, because it's important to have to understand this for providing the result in time.
Thank you very much, Luisa. So this is the aspect to take into account to understand the workflow. Thank you very much. Javier, You already anticipated something. Do you want to add to your reasoning some other aspect that some challenge or some positive aspect looking at the experience you had? You are muted, Javier.
Now?
Okay.
Okay.
Yeah.
We saw flexibility in the ability to adjust implementation to the hospital's reality and allowing integration to reach the expected performance. A clear example was the weekly sample volume. This showed that surveillance projects' initial assumptions must account for variability and that indicators should focus on impact and operational usefulness. In terms of limitation, we would highlight two: bureaucracy, approvals, contracting, internal procedures, which affects timelines and technical quality requirements. In fact, during the project, we found that the initial sequencing protocol did not always provide sufficient depth, which led us to repeat analysis. To make the process sustainable, we changed the protocol to increase depth and robustness, reducing repeats and establishing results. This adaptation reflects the balanced well, innovating while meeting real technical and operational standards.
Thank you very much, Javier. Good points. Francesc, what's your take on the experience on this topic?
Yeah, the most valuable for us was the possibility to exchange our vision on how technology could support healthcare strategies. It was very important for us to, for example, show how our 1 hour time to result could make an impact on patient outcomes, and also the openness of the buyer, in our case, to listen and matchmaking our value proposition with their current needs. Its process, I think it's a process that we really should be repeating it in other contexts, in other technologies, because it's the way to leverage the potential of the private sector and the public sector at the same time. And the most challenging part was at some point when we tried to matchmake with other partners, other industry partners, not only with direct competitors, which it may seem understandable that it is difficult, but also when we wanted to combine our offer with, for example, an IT company, for us as a company, it was a hurdle internally to make our internal process and dynamics compatible and with what it was being asked at that moment. We didn't achieve it, and this is why I consider it the most challenge, the bigger challenge.
Thank you, Francesc. Very interesting and a new point, at least to me. Gaetano, what would you like to add to this list of challenges and the specific positive experience you had?
From our perspective as contractors, the most challenging part has been turning an innovative solution into something that fits real-world operational conditions across multiple stakeholders. In practice, that means aligning timelines, approvals, and governance, managing heterogeneity in processing, and ensuring the solution can be adopted without adding burden to already busy teams. At the same time, the most valuable aspect has been the structured engagement with public buyers and end users. The procurement process forced us to a very clear focus on outcomes and the usability. And the ongoing interaction gave us fast, concrete feedback that improved both the solution and the implementation model. So overall, the challenge is navigating complexity and constraint. The value is that it creates a shared outcome-driven path from innovation to real adoption.
Thank you, Gaetano. I added to the list this experience you had. Laurent.
Yes. Well, in terms of challenges, I mean, it's the experience we have is whether we are in a procurement process with access to buyers through a structured organization, like in our case in France with RESA. It's still a challenge to get these type of project prioritized in hospitals because we are fighting in the digital space. We're fighting against other big digital projects which are complex. We are talking about integration of data platforms. So it's still, even in this case, a challenge, because then you get into complex prioritization process for teams internally in hospitals, which have a tough time to build business case internally and get these type of projects approved. So it takes long. It's for us, we know that we're anyway faced into a long sales cycle to get projects approved and going in. But the real benefit at the same time with that type of project is that since we have like a approved, let's say, solution in a national tender approach, brings a lot of credibility, and then we have like people open eyes to that type of solution. It did make a big difference. So we're seeing right now the effect. It takes time, but the momentum definitely has been created and has changed, let's say, the way we have those discussions with hospitals, which are now really looking into this, saying that, well, this is feasible. Other hospitals are going for it. So now, it builds the process in place, and with the impact that we will be able to showcase with the KPIs involved in these projects, definitely will support that. So overall, it definitely makes a big difference in how we are perceived and how the projects can gain acceptance in the hospitals, even with that type of complex project.
Thank you, Laurent, for sharing your experience and your view. Eudald or Luis, what would you like to add to this really interesting perspective from the contractor side?
Well, from Qualud's perspective, we agree with something that Francesc said, that is the joining forces and effort from public and private institutions in order to boost health. I think with RaDAR, we are already making progress in this area. And also from Qualud's perspective, it's not a challenge, but it's a normal thing from day to day, the unification of different kinds of data from different kinds of entities, the standardization process, which is a reality that we must face and we engage in every day. And with RaDAR, we prove it possible. And I think that's the most valuable and engaging thing in general in this digital area we're living in right now. But from Qualud's perspective, we point out strongly that public and private institutions together, they can really generate results in health.
Thank you. I think that we had a really broad and interesting discussion about the value of public procurement for innovation, and also from your experience, the experience from contractors, the value of public procurement for innovation, looking at its flexibility, adaptability, the opportunity to exchange the vision and expertise from a technological perspective in favor of the client and the engagement of buyers and the interaction are at the core of the value of public procurement for innovation. On the other hand, we also have to consider some difficulties, some challenges, some pain points on which we should work, such as the bureaucracy faced in integrating some solution, the difficulties in partnering and in including external players in the offering, the implementation challenge in a complex environment and operate in a real-world scenario, as well as the integration of data. This is from a technological point of view. So there are, I think, several insights that are valuable coming from this discussion. I think that if we have any questions from the other participants, our speakers are available. If not, I'll give the floor back to Maria. Thank you very much.